taking around 25 mils of blood. So we're taking the platelet-rich plasma, which is called autologous condition plasma, which is separated from the blood. That's the good part. So what we're trying to get into here, tendon inflammation and micro tears. That's typical of tennis elbow. My needle is inside the tear and reaching close to the bone to make most of the platelet-rich plasma and growth factors, ACP, autologous condition plasma. As you can see, this is the blinking cursor is inside the tear, where the insertion of that tendon, and you will have some rehabilitation after that. That's the end of the procedure. Thank you.